Bringing it live to the Pahrump Valley on KPVM 46.3 online and KDWN Radio Las Vegas. Patriots, tune into KPVM 46.3 on July 4th from 1 p.m. to 6 p.m. or online at www.kdwn.com for the Patriotic July 4th Radiothon to defeat Barack Obama.
Our country deserves better. PAC. TeaPartyExpress.org is responsible for the content of this ad.
In their decision, the Supreme Court states that in 2010, the Congress enacted the Patient Protection and Affordable Care Act in order to increase the number of Americans covered by health insurance and decrease the cost of health care. The key provision is the individual mandate, which requires most Americans to maintain minimal essential health insurance coverage. For individuals who are not exempt and who do not receive health insurance through an employer or government program, this means of satisfying the requirement is to purchase insurance from a private company. Beginning in 2014, those who do not comply with the mandate must make a shared responsibility payment to the federal government. The act provides that this penalty will be paid to the Internal Revenue Service with an individual's tax and shall be assessed and collected in the same manner as tax penalties. Another key provision of the act is the Medicaid expansion. The current Medicaid program offers federal funding to states to assist pregnant women, children, needy families, the blind, the elderly, and the disabled in obtaining medical care. The Affordable Care Act expands the scope of Medicaid program and increases the number of individuals the states must cover. Lower income and middle class families will be eligible for subsidies to help pay premiums starting in 2014. There's also an added safety net for Americans insured and uninsured. Starting in 2014, insurance companies will not be able to deny coverage for medical treatment, nor can they charge more to people with health problems. Seniors also benefit from the law through better Medicare coverage for those with high prescription costs and no co-payments for preventative care. But hospitals, nursing homes, and many other service providers may struggle once the Medicare cuts used to finance the law really start to bite. Illegal immigrants are not entitled to the new insurance coverage under the law and will remain one of the biggest groups uninsured. Experts expect costs to keep rising, meaning that lawmakers will have to revisit the issue perhaps as early as next year, when federal budget woes will force them to confront painful options for Medicare and Medicaid, the giant federal programs that cover seniors, the disabled, and low-income people. The healthcare overhaul focus will now quickly shift from Washington state to state capitals. Only 14 states plus Washington, D.C. have adopted plans to set up the new health insurance markets called for under the law. Called exchanges, the new markets are supposed to be up and running on January 1st of 2014. People buying coverage individually as well as small businesses will be able to shop for private coverage from a range of competing insurers. The Medicaid expansion would cover an estimated 17 million people who earn too much to qualify for assistance, but not enough to afford insurance. The federal and state governments share the cost, and Washington regularly imposes conditions on the states in exchange for money. Since the penalty for not purchasing minimally adequate health coverage is essentially a tax, the court ruled it constitutional. The Urban Institute concluded that 18.2 million Americans, 6% of the population, will be required to purchase coverage. Of that, 10.9 million low-income people will be eligible for federal subsidies to help pay for coverage. Just 2% of Americans, 7.3 million people, will have to buy new coverage and won't receive federal subsidies to do so. With this law, you cannot be denied coverage for pre-existing conditions. Small business owners will be eligible for billions of dollars in tax credits to help employees pay for coverage. Immunization and preventative care must be offered at no cost. Enrollees' dependent children up to age 26 will receive coverage. An appeals process will be set up for consumers who can appeal insurance company decisions. Insurance companies will be blocked from imposing excessive premium increases. Arbitrary lifetime limits on coverage in all plans will be removed. Insurance companies will be blocked from dropping coverage while a patient is sick. And as of January 1st, 2014, all low-income individuals who are not disabled or elderly will be eligible for Medicaid. You must earn less than $29,000 per year for a family of 4. However, the federal government will not be able to allow to deny states existing Medicaid funding if the states decline to opt in to new Medicaid expansion. The Medicaid expansion will cover 17 million more people. Currently, 62 million Americans receive coverage under Medicaid. Businesses with fewer than 50 employees will be exempt from the mandate. However, they could earn tax credits for paying employee premiums if they do so. Businesses with 50 or more could opt out and pay a penalty, which might be much cheaper than the premiums. The decision leaves in place the so-called individual mandate, the requirement on Americans to have or buy health insurance beginning in 2014 or face a penalty. What does this all mean to you? Well, in 2014, the penalty will be $285 per family per year, or 1% of income, whichever is greater. By 2016, it goes up to $2,085 per family, or 2.5% of income, although many Americans are exempt from that provision. Healthcare exchanges, which are designed to offer cheaper health insurance care plans, remain in place as well. I'm Deanna O'Donnell for News 46.